Wow, there's so many of you. Thank you for coming. How was block 1? Yeah? Well, you're here, so you were successful in block 1, and now you're moving into block 2. What's the big difference that you guys noticed between block 1 and block 2? More application-based, okay. Anything else that was different? I'm sorry? Less assignments, more thinking, yep. Anything else that you guys can think of? Yes? The classes are small because we start splitting you up, right? We start splitting you up in psych and med surg and AM and PM, so the class sizes get a lot smaller, so you start missing your buddies, the plan that you had. And I know that that's hard sometimes, but I also know that building more relationships can only be helpful. Because when we start working in a group, you're going to notice that people start thinking the same way. And sometimes it's helpful when somebody else doesn't think the way that you do, because they can help you grasp a concept in a different method. So that's one of the things that can be helpful, even though it's still kind of like I miss my buds kind of piece. But so you remember me, I'm Diana Breed, I'm your chair, but the reason I'm actually here is not because I'm your chair. The reason that Gwen and Jerry asked me to do this is for many years I taught for Kaplan. Does anybody know about Kaplan? Yeah, they're an NCLEX review course and that kind of piece. And part of their teaching me to be ready to teach you guys was all about how we have to look at these questions differently and to help keep me up to date on all the fun and exciting things that are happening in NCLEX. And none of it is hidden information. You guys can go on to the NCSBN. You can pull off the test plan today if you wanted to know what's going to be on NCLEX. What terminology are they utilizing? All that stuff is available to you. So even the new next gen stuff, all that stuff is out there and published for you guys to see how they score it, what they're doing with it, how the questions look, because it's not a secret. What is difficult is how to change your previous methods to accomplish this new type of testing. And that's what happens in nursing school in general. So with that thought in mind, now that you've gotten through block 1 and we're going to start moving you into application, you're going to see that every block is harder than the block before. And it's set up that way. It's set up for you to stair step on each block. So what we want to do is help prepare you as you are moving through those stair steps. And it might require a little bit of adjustment in the way that you've studied before. So we thought we would touch base with you on that. All right. Any questions so far? Yes, no? Okay. So one of the things that when I do one-on-one with you guys, and you're always welcome to get a hold of me and tell me, yeah, can we sit down and do some one-on-one test questions? I'd be happy to do that with you. But one of the things that I always work with when that happens is, what do you know now? Because our brains are extremely amazing organs, and one of the things that it can do is it can trick us into thinking that we know more than we think we know. So a question I ask very commonly is, do you really know the condition? And I ask you to tell me what would be the 3 most common signs and symptoms that you would see in a patient with this condition. And what would we do about it? And what medications are we likely to have to order for that? And if you are unable to do that, then your brain tricked you into thinking that you did know, because you recognized it when you reread it, your study notes, right? So what I would ask you to do is look at the condition and take a blank sheet of paper and identify things and just write them down blankly. Instead of trying to figure out just, can you recognize it? Can you pull it out of your head yourself? Which is what has to happen on a test, right? So instead of rereading your notes over again, test yourself. Do I know this or do I not know this? All right. So write your symptoms down. Write your vital signs down. Where would I expect my vital signs to be if my patient's in heart failure? Where would I expect my heart rate to be? Elevated. So what's elevated to you? What number would say elevated to you? Above 100. And that's what we want you to do. We want you to write the number because they probably won't say an elevated heart rate. They'd probably give you like a heart rate of 104, and you're expecting you to recognize that that's elevated. Does that make sense? So you would do the same thing with your blood pressure, the same thing with your temperature. Okay? Then you would look at what lab tests. And again, we would be very specific. So what lab test would we look at for a patient who has heart failure? Sodium, potassium, magnesium. Specifically, why sodium? It can, it's less likely to. Of those three, which one is most likely to affect the heart? The potassium. So what number would I say is a problem? Over 5. Anywhere over 5 or anywhere under 3, right? Or 3.5, depending upon which hospital you're in today, kind of thing. So that would be one of those pieces that I would look at. But if I was really looking at how badly they are doing with their heart failure in general, I would look at the BNP, right? Because potassium would be more of an acute issue. So it would depend on what the question says. So see how you have to kind of pull that data out of your head, which is a lot harder than if I'm like, oh yeah, we talked about that in class, and recognizing it. The next would be what assessments are critical. So I have a patient in heart failure. What assessment is a critical assessment for me to do? Lung sounds and heart, which would include what assessment? Like pulses, excellent. And not just one pulse, distal pulses, right? To see is my flow going all the way down to my feet kind of piece. Urine output would be a huge assessment because that would tell me I have end organ perfusion. All kinds of those things that would kind of help me out that, yeah, okay, I really understand this condition. Okay. Then we would look at what we would do for that condition. So what do we do for this condition? And we include things like nursing interventions. One of the most common nursing interventions is what position did you put this patient in? So which position do we like best for these people? What do you guys think? Semi-Fowlers is our favorite. Do you know why? Okay, if I was sitting up, like sit up, you guys sit up at a 90-degree angle. So what's 90 degrees? Straight up, right? Straight up with your feet straight down. Okay, so if that's a 90-degree angle, where's my liver pushing right now? Kind of like after you've had a big meal, right? And it can kind of push up against it. But semi-Fowlers allows a bigger, deeper breath, yes? Without my abdomen and my GI system and my liver getting in the way with that piece. So too high is a problem. What's the problem with too low? Where's fluid gonna want to be? Fluid stays as low as it can go, right? That's that song. How low can you go? That's where fluid likes it, right? So if I'm laying down, where's fluid gonna want to be? In my lungs and that at the end of that in my bases. Does that make sense? So that's why you have to think about, okay, so my nursing intervention would be to sit them up, and then I have to think about why. Why am I doing it that way? What am I trying to accomplish? Okay. What meds? I know you guys love pharmacology. Isn't that your favorite? And if I could say, back when I was a nurse, but honestly, I didn't have the number of meds that you guys have to know right now. And so it can be overwhelming, and I understand that. That's why we tell you to start with the classes, the category. Because as long as you know the category, you might be able to answer the question just by that alone. All right, if I'm trying to decrease preload, what are the most common drugs? What categories would do that for me? If I'm trying to decrease afterload, what is the most common category? So at least you'd have an idea. All right. What does my patient need to know? That's your education, and that's the question you ask yourself. Once I send this patient home, what do they need to know so they don't bounce back to me tomorrow? Right? So off the top of your head, Let's have this side of the room. Well, it's something that you would make sure a heart failure patient knew before I took him to his car. I'm sorry, his diet. Excellent. And what would be an important part of the diet? Low sodium, which would be no chips, which would be so sad for me, right? I'd be like, we got to have another way to work around this. I'm not going without salt, but I get how some people have to. But that's one of the reasons why I understand why people don't follow their diets. So it's one of those pieces. So you start looking at, how do I make sure this patient doesn't come back? And the best way is to teach them how to take care of themselves when I'm not there handing them the tray of low sodium, right? What are the things they're going to have to do for themselves safely? Then we look at what complications we're trying to avoid. So when we're looking at complications, what does that mean? Complications. Adverse reaction. Okay, so when we're looking at meds, right? So every med has a complication, contrary to popular belief, even oxygen, right? So every med has a problem. Most of the time we're weighing benefit over adverse reaction, and we're going to go with that. But all meds can work too well, salud, or not well enough, right? So those are things that we're looking at. We're also looking at if our meds are not working, right? Or our treatments are not working. Think about it. If all of our meds or all of our treatments worked exactly the way the book says they were supposed to work, we'd never have an ICU because all these people would just get better and go home. But that's not what happens. Every med works differently. So what are we looking for it to happen? And then how do we know they're better? That they're safe to leave us. Questions? So if you can do this yourself, about 80% of what's in your notes and in your book, then you're probably ready for your exam. All right? So what I did, and this is the last 2 pages of your handout, and again, they're going to be posted online, is 2 different ways to organize this data. If you looked at this and your eyes just went like, oh my God, that's not going to work for me, because some people can't handle this kind of messiness, then I gave you another method of a little bit more linear, okay? Either one gives you a place to start putting this down. And you're going to, I call these living documents because the first time you fill them out, you're filling them out with what you have learned in class, what you have learned from your chapters, what you have learned from your videos, right? And then what's going to happen is once you have a solid base, you're going to take an empty one and see how much you can fill out without looking at your previous one so that you can see, yes, I really do know it. There's 2 reasons to do that. One is because, again, our brain will play tricks and they'll say we know it, but we can't pull it out of our brain. But the other is to give you the confidence to pick the answer that you know is right and not get tempted by a different one because you're comfortable with your knowledge. How many of you guys have had answers, picked answers, and then you changed it to the wrong answer on your exam? Just a few of you, looks like. All right. And it was all because you weren't sure. If you've done this and you can go back and say, I can fill this out without any help from my book, then you can be more confident in the first decision you made. And you won't switch it and get it to the wrong answer. Does that make sense? Questions? Okay. The next thing that we're going to talk about is once you've been able to verify that you know it, then you're going to use NCLEX questions. NCLEX questions. Now, I consider NCLEX questions a very valuable resource, and you do not want them to be wasted. Meaning you do not take them when you're bored and you're just kind of like standing in line and you're like, oh, I'll just do a few questions. Because you're not thinking about them. You're not putting effort into them. You're just doing reading, basically, and getting the right answer. But the problem with doing it that way is you'll never see that question on an exam. You'll definitely never see it on NCLEX. So you've learned how to answer that one question, but you didn't train your brain how to think about that content and that information. So you want to use your NCLEX questions very valuably. How many of you guys can get into your passport? Have gotten into your passport yet? Couple people. Okay, your passport was part of your package. And it will be, if you bought the whole package, it's part of your package. Not everybody opened it yet because there was no assignments. The assignments don't usually come till 3 and 4. But those questions are NCLEX style questions, higher level questions. They're different than your Prep U questions. Remember, Prep U is for you to be prepped for class. So they're a little bit higher level. They're more difficult. They help you get ready for that kind of exam. All right? So when you start, then you start taking your NCLEX questions and you add any information that you didn't know to your map. Like, oh, I didn't know that med did that. So now I'm just going to add that and I'll know to look for it the next time. That's why I call it a living document, because every time you do a question about that content, you'll be able to add that information to one place. Because how many times have you guys been studying and you're like, oh, wait, that's a note from that day, and you're pulling that piece of paper, and then, wait, I took notes on my computer that day, so that's this information. And all your information is kind of scattered all over. It's harder to learn it that way. I don't know how you guys do it. I don't even know if I could find it that way. But at least you probably know where it is somewhere in your notes. But this way it'll all be in one place. Okay? So when you're doing that, you're going to learn around that question. Because remember, you're never going to see that question again, right? But you are going to see similar content. So if you got a question wrong, or if you got a question right, but you just guessed and you really didn't know it, I'm like, yay, you got that question right, but still you didn't know the information. So you're going to go back and you're going to review around the content. What that means is you're going to look at that content and go, oh, it was about the potassium level and the heart, but I didn't put it with this medication. So now I'm going to go back and review, is there any other medications that would affect the potassium? Because the next time they ask a question about it, it may be a different med, or it may be a different electrolyte. So you study around it, not just that one rationale. Does that make sense? Because then when you get ready for the next time we ask something about heart failure and electrolytes, you'll be ready. That's how you use your NCLEX to be ready for an exam. Okay? And you can use any type of NCLEX. It's just that I know Passport comes with your package, but you can use any of them. You can use Saunders, you can use Lippincott, you can use Mosby, whatever works for you. Okay? All right. So this is the difference of nursing school exams and every other exam that's out there. We used to look for the right answer. And we would study really hard, make sure we could recognize stuff, and then we would, as soon as we read the question, we'd like, okay, let me go down and see if I can find what I remember reading about that and connect the two. But that's not working as well anymore. And the farther along in the program you get, the harder it'll be for that to work again. Because you are no longer looking for the right answer. You're looking for the best out of the 4 they gave you. And it may not even be your favorite answer, but you have to go with what they give you. And this is a nursing thing. This is what nurses do every day, all day. Is we have a patient in front of us, we're taking care of him, and we want to give this med, but he's allergic to it. Or we tried that med and it didn't work. Or he refuses that treatment because it doesn't make him feel good. Whatever the reason is, I now have to come up with an alternative that will give me the same outcome. That makes sense? And so because we do that all the time, that's the way the questions are worded. They won't ask you a question that they know 100% people will get right. They're asking you questions to help you determine where your level of knowledge is. All right? So instead of like saying this is the right answer, what you have to do is look at each and every answer and figure out which one gives me the best outcome with the least amount of complications. And it might not be the one that you memorize, but as long as you can do that thinking, then you'll flip to that answer. Does that make sense? So successful students always read every answer. And then they start looking out for which one is going to be the best. They don't just pick one and stop reading. Because for all we know, the better answer is number 4. Right? Okay. So, have you guys ever taken a test? You look at the question and you like have nowhere to figure out how to start to answer this question. Anybody ever do that? A couple people, where it's just like, I don't even know where to go with this. So I'm going to give you stair steps, because even that kind of anxiety makes it even more difficult to answer the question, because now you don't even know where to go. So I'm going to give you our little stair steps for success. Okay? So if you come up with a question and you're like, I have no idea where to start, you're going to say, okay, so step one is to do this. So step one is to do this is find and figure out what the question is asking you. And I know those of you who have Gwen, where's my PM people? Those of you who have Gwen, she talked to you guys about making sure that you have to look at maybe the last sentence to find out what the question is asking you. That's part of it. Just validate in your mind, the question is about this, okay? And you're going to try to do it without looking at the choices. Now, sometimes you have to look at the choice, but it's very tempting to just move forward and pick the right answer, but you haven't actually ever cemented in your head what the question is about. And there's a reason I'm telling you to do it this way. There are some very good answers that have absolutely nothing to do with the question they asked you. So you will be tempted, if you haven't solidified in your mind what the question is about, you'll be tempted to go with one of those very good answers, but it didn't answer this question. So that's why we're telling you to solidify that in your head before you move forward to look at the answers. Okay? And we should be able to bring down what's going on with this question to about 3 to 4 words. Okay? And we're going to practice doing this together as a team. So once you know the main idea, then you get to look at what's offered to you. Okay? And again, remember how I told you these, I think these questions are very valuable. This is where you're going to find out how does your brain work and how do you think about things. And this is the only time that you're going to be able to figure that out. And I know that because when you come into my office and you sit in front of me about a test question and you're like, ah, I knew that was the right answer. And I'm like, well, that can't be true. Because no student I know goes, I know A is the right answer, but I'm just going to pick C because I don't need that point. Nobody does that. So there must have been a reason that you pick C. It's just you can't remember it now because it's been so long. But if you write down why you want this answer now, you'll be able to think about it later. And then if we have to correct whatever thinking that was, we can do that knowing how you thought. Otherwise, it's just harder to figure out why you chose that answer in the first place. All right? So you're going to write down, what information do I get? Do I need it? Does it match what my question is all about? Or why did I say this is not even close to the right answer? So why did you eliminate this answer? Sometimes it's just you missed one word. How many of you guys have done that before? I missed one word. So unfair. Seems unfair. They're like, oh, I just got that one word. I did that on one of my exams as well. If you got it right, make sure you're correct in your thought process. If you didn't, you're going to review it, that information. All right? So that may be different than how you are studying now. If you have been successful, I am not saying you have to study this way. I am offering you an alternative. Should you notice that your method starts to not being as successful. What I don't want you to do is continue with a method that is not being successful. All right? So, and if you want us to go over it with you, how many of you guys signed up for the Student Success Canvas course? Anybody? Couple of people, yay. They have some great stuff in there. So feel free to work with them. All right? So in your packet, we have practice questions. So remember, what was our first stair step? What's finding out what the question is asking us. So try to cover up the answers and just look at the stem and tell me write down what you think the question is asking you and try to use less than 5 words. So go ahead and write that down. What do you think the question is asking you? Who wants to share what they think the question is asking them? Go ahead. Which of these lab values is wrong? All right. What do you guys think? Are you guys comfortable with that? Who has something else? What should be done first about what, though? About the lab values. What should be done about the lab values? So now I have to go back and look at the lab values. Is there anything wrong with the lab values? Neutrophils, 62? Nope, that's normal. Goes up to 70. Hematocrits, it's a little on the low side. Okay, so relatively normal. Do I have any other symptoms in my question? No. So I just have to work off the lab values. So I don't know if my patient is symptomatic. If I have anything, they're on the lower side, right, of the H&H. So basically normal labs, perhaps a little low on my H&H. What do I do about that? That's what the question is asking me. So does this patient need reverse isolation? No. Does this patient, do I need to notify the healthcare provider? Do I need to make sure no flowers are taken into the room? Should I continue to monitor the client? And that's where they want you to go. So we have to interpret. Do you see how much knowledge they can shove into one question? Do you see how they realize? That's how they can tell that you're a safe nurse practitioner in only up to 75 questions. Because the goal is to see as much thinking happening at one time. So what did you, if I was doing my concept map, what condition do you think I would put in that? What kind of conditions? Based on what they asked me about. Yeah, maybe some type of hematology condition, like leukemia or something like that. Does that make sense? And then I would write down here, these are all things only if my white count was a certain level. Or maybe a bleeding condition, only if my H&H was a certain level, and I'd have to put them on bleeding precautions. Does that make sense? So then I would verify that that data is in my concept map. Questions? Do you see how knowing what you think the question is talking about really makes the rest of it go easier? But you have to slow down. It will take you longer. And I think that that causes some angst for some people because they're like, oh, I already take so long to get through my test. And what happens if I run out of time? This is a skill. This is a skill like any of the other skills that we've been teaching you, like physical assessment. How long, when you first started doing a head to toe, did it take you to get through the head to toe? Years of my life, I'll never get back, waiting for you guys to finish your head to toes. It's just, are you that slow still? No, you're much faster because you practiced. This takes practice. You have to make a conscious effort to do the questions this way, and then you'll get faster at it. Okay? Ready to try another one? All right, let's do another one. First step is to do what? Read the question, figure out what it's asking you. Very good. What are we looking for? Remember, what's this question asking us? Which ABG is the worst, but not just the ABG, what else? And the condition. Remember, when you're looking at these kind of questions, like who we go see first, we're looking at, do I expect that? Or do I not expect it? Is it a problem? So you're looking for the patient with the condition and the ABG that is a problem. All right, you guys ready? Did you pick your answer? I'm going to ask you to actually circle your answer. No one's going to see this piece of paper but you need to know what you think. So you need to feel confident in the, okay, this is where my brain went, so I can learn if that's correct or not. Ready? How many of you guys picked this one? Couple of you. Okay, a good significant amount. Which one did you think it was? If it wasn't 3, what did you think it was? 1, 2. I heard 2. Yeah? Okay, 1, COPD. What's COPD? If I had to decide, is it a chronic or an acute problem? A chronic problem. So that's probably why I'm less likely to go there. But if they were significantly in trouble, then I would definitely make a stab at it. However, 7.34 on a scale of 1 to 10, 10 being about to die, 0 meaning they don't even need to be in here with me. What is 7.34? Like maybe a 1, right? Because it's only down by 1, right? So I'm not, see how that helps me decide how concerned am I with that? How about the PaO2 of 70? For a COPDer, a patient with this chronic disease, what do I think about 70? 10 about to die, 0 going home. What's normal? Let's go there. Do you guys remember what normal is? 80. Okay, 80 to 100 is normal. Somebody with this chronic disease is 70. So probably like a 3 or 4. It's probably, I mean, for all I know, that's his norm, right? But not as significant. So that's how you kind of start making the decision. This person has lived with this condition. To have COPD, he didn't get it today and he was fine yesterday, right? COPD is a long-term problem. And then the CO2 is up a little bit, but obviously his body is used to it because my pH isn't that far down. If you and I all of a sudden went to 55 CO2, you would see our pH drop a lot harder because our body hasn't learned to compensate for that yet. But this patient has a little bit higher bicarb. His body's used to it. Does that make sense? So those are things that we look at. 2, we're doing for somebody, again, this is an acute problem. Adult respiratory distress syndrome is something that happens after they've already had an insult to their lung, like they've had really bad asthma, now they're in ARDS. They've had really bad pneumonia, now they're in ARDS. So again, another chronic issue. Okay? Questions? The pneumothorax would have been the one I went to because that's an acute issue. But I couldn't have gotten better numbers if I'd made them up, right? I mean, that guy's doing just fine. The reason I put this question in here is for you guys to see the trending versus the pure number and applying it to the patient in front of you versus just looking at the number. Okay? Because that's what nurses have to do. All right, let's try the same kind of question again. Same kind of question. Who do we prioritize? Is it an acute event? Is it a chronic issue? Is it an expected thing? How can you cheat when there's no points? It's always a competition. Life is a competition. All right. So we're going to see who we need to see first, right? We're talking, that's what our question is talking about. Who do we go see first, meaning who needs us the most? So, number one, who reports being dizzy when getting up? Somebody with pneumonia. That's an acute problem. Should they be getting dizzy when they get up? No, so that's an unexpected issue. So I'd probably hold on to that one. But remember, we said successful students read them all, right? How about number two? Cystic fibrosis needs a script for his pancreatic enzymes. Okay, chronic problem for a GI system that hasn't even told me that's a problem. What's the worst that could happen is he might lose a little bit of weight in the day that it takes me to get to him. Does that make sense? Because he won't be as absorbing that GI system. How about number three? Lung cancer on chemo, has nausea. Expected, not normal, expected. And that's one of the things that we have to make sure we're very able to differentiate between normal, expected, and concerning. Okay? Crackles in the lungs, never normal. But if you have heart failure, I'm probably going to expect a few. Does that make sense? That means I'm watching it so it doesn't get worse. That's the difference. How about number four? Pertussis, who reports coughing spells so severe that they're vomiting. Pertussis is a problem, but what do I actually worry about with pertussis? Is it because they vomit? It's a respiration issue. Are they having respiration issues? No, they're vomiting. It doesn't say they're having respiration issues. So this is what I call, please don't go all the way to Circle K with your question. How many of you guys have been told you're reading too much into the question? Okay. All right. And especially if you're like a bedside technician in any way, then we tend to read into the questions quite a bit. So I call that going to Circle K. Sometimes you actually go past the question, past Circle K, all the way to QT, but we're going to stay right here in this question. This question did not say this guy with pertussis is having trouble breathing. He's coughing, which is expected, and he's vomiting. That is a GI issue. That is not a respiratory distress issue. Does that make sense? You don't have to agree. You just have to know how to answer these questions. And you have to think about the fact, what could happen if I have this guy with pertussis who's vomiting every time he coughs. If I don't call him back, what's the worst that could happen? He could continue to cough and vomit. Yes? We could, but where did we get the idea that he has swallow issues? Nowhere, because it's not in there. It doesn't. I mean, why would normal? How many people throw up a day? And do you think in our United States? How many actually aspirate? Who are the people at risk for aspiration? Unconscious people, people with trachs, people who have weak neck muscles, people who have a change in LOC, head injury people. But your average person doesn't have that, right? So we can't add it into the question. We can't say, oh, you have pertussis and you're unconscious and you're vomiting and therefore you're going to aspirate. Do you see how far we went to Circle K? We're almost buying Diana a Coke. Anytime you go out, you got to buy me a Coke because that's my favorite. So those are things that we have to think about, and I know it's hard, and I totally get it, but this is the way the questions are written. I personally don't have any vested interest in whether you like the question or not. It's not my question. We're not getting points for it or anything. I just want you to know where they're coming from so that you guys can be successful when you're choosing the right answer. So they want you to go here because this patient will fall quicker than the guy who's vomiting will become dehydrated. Does that make sense? So you don't have to like it. You just have to understand. You just have to understand. And sometimes that makes it easier for you if I can tell you, you don't have to like that question. I totally am okay with you not liking it. But do you understand why they want that answer? Okay. All right. Ready to do another one? All right. Remember, I didn't pick really easy questions because honestly, you can do easy questions without me. These are harder questions. Let's try this one. Remember, what is the question asking you? What is the main issue? You might not know all the terminology, but what do you know? Okay. And you know the term dementia. All right, what's the question asking us? Okay, so how would a nurse manager resolve the patient staffing issue? Yes? So we have a patient staffing issue. That's what I would write down on my paper. Patient staffing issue. So what's the most appropriate way to do it? We all know how we might want to do this, but what's the most appropriate way? Number one, explain that this attitude is a violation of the client's right. What would happen if I did that to the student, to the staff? Okay, so staff might be a little unhappy, and did we solve the issue? Okay, so we could probably get rid of that one. How about number two, request the healthcare provider to transfer the client to the medical unit? Okay, so all we did is turf that problem to another unit that we may need in the future, so that's not helpful. How about number three, discuss some possible options with the nursing staff? Okay, what could happen? What would happen if I did that? Okay, we might get some new options, right? Could it not work? Sure, it could not work, but it might work. And it involves the staff who are having to deal with the situation in the first place, right? So basically, you have your end users involved in the problem, okay? How about number four? Try to find a nurse who doesn't mind being assigned to the client. Okay, it could work, right? How long would it work? Because that person is working one shift 3 times a week. So what are we going to do with the rest of it? So that would work, but it'd be limited. So this, I'm wanting you to think about the fact that it's not a bad answer, but I have this better one here that might solve more of the problem. And that's going to happen on your exams where you're like, but this one's good too. Okay, but which one is better? Have you guys seen that meme? Nursing school answers, which orange is the most orange? Yeah, that's what we're looking for you to see. We're looking for you to see is which one is a better, more encompassing answer that provides our patients with what they need. Okay? We have 15 more minutes. You guys good with doing some more? Okay. No one likes this question. I'm okay with that, though. Tell me what you guys think. Oh, she already posted it. That's okay. Oh. So what's the biggest issue here, you guys? Okay, so I heard not eating, I heard taste. So neither one of them by themselves is an issue. What are we really worried about for this patient? We're worried about nutrition, his nutritional status, yes? Okay, so that's what I would put next to it, is his nutritional status. Because I could probably go a day without eating and it really wouldn't affect my nutritional status. But other people, maybe not so much. All right? So If that's my concern, ask the dietitian to consult with the client on food preferences. Would that adjust his nutritional status?
It might, because if he's eating enough of the things that he likes and he has more of those options,
we might be able to use that piece of information to help us, right? But it says they want what's first. So let's put a little question mark. Could help. Could help. How about number 2? Medicate the client before meals with an antiemetic medication. Because we're not going to Circle K, are we? Because does it say anywhere in here he's not eating because he's nauseous? No. So we cannot add that to the question. That's what a lot of people do. A lot of people get that one wrong because they're always like, but chemotherapy caused it. Not all chemotherapy, and it didn't tell us he did, right? How about number 3? Ask the healthcare provider to suggest an over-the-counter nutritional supplement. Could that work? Maybe. Just like one maybe could work, right? They're talking about the things like the high-calorie shakes and things like that. So it could work, but we're not sure. How about number 4? Check the client's current weight with the client's usual weight. Do I need that data? It's an assessment, but do I need it for this patient? Tell me why. You're right. Tell me why. Right. How severe is this not eating affecting his nutritional status, which is what you guys said was the big issue, right? If he's not losing weight, then it makes sense to do these over-the-counter consult things. If he is losing weight, we might have to do something more drastic. Yes, dear.
We're not bringing in because it doesn't say he's not eating. It just says he's not enjoying it.
He's not enjoying it. So we're okay. So that makes perfect sense. So doesn't taste like it used to. So our thought is, what should we do about that? And so if it's a problem with his weight, then we have to do different things. If it's not a problem, then we can talk to him about spicing up his food differently, that kind of thing, because his issue is that it doesn't taste good. Good question. Good question. Thank you. Anything else? All right. Next one. This is a more difficult question. You'll see these are kind of one of the more next gen type of questions where there's a lot of data. So I want you to look at this and tell me, what are we concerned with? What's the question asking us? Yes, ma'am. That's the initials of the nurse. That's okay. You guys haven't seen a lot of Mars, so I'm glad you checked. So what's the question talking about here? What are we really looking at? Yeah, it's overwhelming, isn't it? So let's start for just a minute. We're looking at our MAR, who has type 2, and our MAR is completely filled with insulin types. Yes? Okay. So now, how do we care for this patient who's been getting insulin all day? That's what the question is asking you. So what I need to figure out is, for each one of these things, does that make sense based on when he got his medications? So what data do I need to have in my head that will help me answer this question? Okay, blood sugar levels, which they put in here for us. Okay, so if they didn't give us his eating, they're going to go with the usual breakfast, lunch, and dinner kind of thing. What was administered, which is in our MAR, and active time for those types of insulin. When is it going to kick in? And therefore, what does my patient need? that make sense? That's the hard thing. So I know that they kind of hit those things hard for you guys in block 1 on NPH versus regular versus Lantus versus all those fun things, but this is the reason why. Is what does my patient need based on when they last ate and what I gave them last? So which nurse am I? I'm the night nurse, right? I'm the night nurse. I'm coming on. When was his last dose of insulin? 4:30. And what kind was it? The Humulin N, which means it's going to peak about when? About 6 hours, because it depends on which one, but about 6 hours, which will be when? About midnight, right? So I'm going to need to make sure that he has enough carbs on board so that it doesn't affect him. Salud. Because everything else, checking, I don't need to check his blood glucose immediately because it's only been 3.5 hours, right? So what does that matter? It hasn't kicked in yet. Having the UAP give him orange juice, how long is that going to last at 7? If I give somebody orange juice at 7, when's it spike his blood sugar? Immediately. That's the goal of orange juice, right? That's why we love it. It's because it'll move it up right fast. When is it going to go away? Within about 30 minutes to an hour, right? So that's not going to help me for later on, right? And then teaching them about diabetic ketoacidosis, does that solve any of my problems? So it's not my favorite answer, because what I would like to do is give him food, like a bigger meal or something like that. But at bedtime is about what time? 8 to 9. Wow, you guys go to bed early. 8? Like, in the hospital, everybody goes to bed. You're all teenagers and you have to go to bed at 8 o'clock at night. All right. So if I give them a snack at 8 and it's a high protein, high carb snack, is that going to cover him for those hours? That's the goal. Does that make sense? All right. Again, not my favorite answer, but it was the best out of the 4 they gave me. All right. Ooh, let's do this one more question. Because didn't you guys just do patient in a box? Yes, you did. What do you think? What's the question asking me? I have to interpret these results to tell me what kind of patient I have in front of me. Similar to dehydration, right? Similar to dehydration. So what's the question asking me? What's that last line? Which one do we not give? Which one do we not give? That's why we read that last line again. Make sure you have it right. What fluid would we question? There you go. You guys ready? I'll hold off. Keep. They're thinking still. Okay, make your final decisions. Tick tock, tick tock. Ready, set, go. D5W. Why do we not want to give D5W? It'll dilute. As the sugar is absorbed, what's going to happen to that fluid? It's going to become hypotonic. Do we want this patient to get a hypotonic solution? No, it's going to make it worse. So that's how the activities that your faculty are doing with you in class end up on a test question. Okay? I probably have time for one more question. You guys okay? Let's do it. Select all that apply, your favorites. Yay! Well, I always tell people when they're doing select all that apply that remember that select all that apply, it's easier to make them more difficult questions. So they're higher on the scale. So that means you must be doing well in NCLEX if you're getting a lot of select all that apply. You should be very happy because you're doing well. Who needs reverse isolation? I want you to think about what reverse isolation. You might not know that term, and this is pretty common in NCLEX as well. They won't always use exactly the term that you may have read or that we may have used in class. The goal is for you not to memorize those things. It's to understand them. So you have to think about if normal isolation is this, what is reverse isolation? Think about what that is. And if you can think about that, then that'll tell you the answers to this question. So if normal isolation means I do this, what would reverse isolation mean? No, because that's a type of regular isolation. Very good. All right, so what's reverse isolation, you guys? Protecting the patient from us. Excellent. Normal isolation is the patient, we're being protected from the patient and whatever they have. Reverse isolation is when we're protecting the patient from us. So does number one, a client with a white count of only 600 need reverse isolation? Yeah. How about number two, does a client with a burn injury of greater than 30% need reverse isolation? What about number three, somebody with viral hemorrhagic fever, reverse isolation? No, regular isolation, please. How about number four, child with chickenpox, reverse isolation? How about number five, client with HIV? No. Why not? We didn't get any lab values. People are positive with HIV for how long in their life before they become immunocompromised? What is the term that we are looking for that indicates they are likely to be immunocompromised? When they're in full-blown AIDS. Absolutely. And they have a CD4 count and all that fun stuff is happening. Does that make sense? AIDS, I would look at it closer. And they wouldn't put that in there. They would put like a white count or a CD4 count or something like that. All right, questions for me? All right, so if you want to meet with me, I am more than happy to meet with you guys. If you want to do it in a group, just make sure you send me a couple of dates and times that work for you, and I will figure out around my crazy, weirdo meeting schedule. All these things are going to be posted for you on your Canvas course. All you have to do is put it in slideshow view, and the answers will populate with a different color. Okay? You know what, your PassPoint, so she asked me what I would recommend for you to purchase, and your PassPoint is one of the better products because, well, one, it comes with it already, and two, because they have some pretty high level. But any of the higher level books, the only thing I'm going to tell you is remember, they make those books for the entire program. So some of them are going to be significantly easier than others because it's for all blocks kind of thing. So that's fine. They all have their pluses and negatives. You may want one with just questions. You may want one with like the outlines to kind of bring it down. UWorld's fine. UWorld's pretty good. It is very expensive. I don't know. I mean, I don't know that I would do that now, knowing that you're going to need it for NCLEX, but it's up to you guys to pick what works best for you. Thanks for hanging out with me today, you guys.